Hello, everyone. My name is Dr. Aditi Alawat, and I am a neurologist at Beth Israel Deaconess Medical Center in Boston, Massachusetts. Today, we're going to be taking a deep dive into understanding dementia. So a little bit of an overview. We're going to be talking about 4 different flavors or subtypes that constitute the umbrella term of dementia. What I mean by that is that there are many different forms of dementia, which some of you may not have known. The most common is Alzheimer's disease, which many of us have heard about or have been affected by for personal reasons. But in addition to Alzheimer's, there are other subtypes of dementia which are just as important. That includes vascular dementia, frontotemporal dementia, and dementia with Lewy bodies. So let's figure out what is dementia. Well, a basic definition, which I think really explains what dementia is, including all the different subtypes, is a disorder that is characterized by a decline in cognition involving one or more cognitive domains. This means that you have trouble thinking, and it involves not just memory, but a lot of different cognitive domains that allows us to function in the real world and what makes us ourselves. So what do I mean by a cognitive domain? Well, there's 6 different cognitive domains that makes up how we process information and our ability to function. Each cognitive domain involves different parts of the brain that interlap with each other and work together to make us who we are. The first cognitive domain is pretty self-explanatory. It's memory, and it involves immediate memory, a little delayed memory like a couple of weeks to months, and then remote memory. And obviously memory is affected in all different types of dementias. But in addition to memory, there's so many other cognitive domains that go awry and have trouble. And those problems really do also cause difficulties in patients who suffer from dementia. So the next cognitive domain that's really important is the visual one. The visual cognitive domain allows us to look at different pieces of information with a visual input and allows us to infer what different visual stimuli mean. So what do I mean by that? For instance, if you're looking at a painting of a face, your brain looks at a pair of eyes, a nose, a tongue, a mouth, and immediately through visual processing inputs and this cognitive domain, you are able to figure out that the eyes, the nose, the mouth all together forms the face. When you have difficulty with cognitive domains, like the visual one, some people with dementia or strokes and other problems will see a pair of eyes and a face, a pair of eyes and a mouth and a nose, but they won't know that it's a face because their cognitive visual domain is affected. Another example of this is looking at a tree and seeing leaves, branches, a trunk, but not being able to put that all together and understand that it represents a tree. Another very important cognitive domain is executive functioning, and this really has to do with impulse control and being able to organize your thoughts to complete a task. Language obviously has to do with your ability to talk, but it really has to do with comprehending language, speaking fluently, name, vocabulary, repetition, reading, and writing. All these different functions of language can be affected in different ways, and so people can have different flavors of language problems in different types of dementia. The last 2 are also very important, including spatial, which basically really works in conjunction with the visual cognitive pathway. And basically, it takes the visual processing and allows you to figure out where you are in space. So for instance, with your visual cognitive domain, you recognize that you're in a neighborhood that's familiar, and then the spatial cognitive domain helps you to navigate your way back to a familiar place. And oftentimes when the spatial cognitive domain is altered, you really don't know where things are. So you could be in a familiar neighborhood but not really remember where your house is, or you can place different items in a room and not remember where they're placed because your spatial reasoning is off. And lastly, attention. This just means your ability to focus on a task and get something done. Often this is one of the ones to go quickly because your attention span is often shortened in dementia. So overall, dementia affects between 4 and 5.7 million older adults. As I said before, Alzheimer's is the most common form of dementia and affects 60 to 70% of all the different adults with dementia, but the second most common is vascular. There are increased rates of dementia in general because people are living longer, and so they're accumulating more of the brain damage that we're going to talk about that causes dementia. And as we age, we expect the rates of dementia to go by 3 times by the year 2050 to a total of 13.8 Americans. The risk is higher in women, 1 in 5 compared to 1 in 10 for men. There's many different reasons, including possible estrogen and other genetic factors, which we won't go into in this talk, but it is a very interesting subtopic for you to research. This is an example of the Montreal Cognitive Assessment, which we also call the MoCA. This is a really awesome test that we perform when patients come into the neurology clinic, and we basically test all the cognitive domains that I just talked about a couple of slides ago. Because as you recall, dementia is a problem with 1 or more cognitive domains. And so if a patient has trouble with a number of these different categories, then more likely they are to have dementia than not. This test is scored out of 30. Anything 26 and above is normal. Anything below 26 means that you have either mild cognitive impairment, which does not mean that you have dementia, but it shows that you have some issues. And anything less than 22 out of 30 says that you probably have some kind of issue with your cognition. Just to give a couple of examples, this first part, you connect numbers to letters and make trails. So for example, number 1, you then connect to A, then you go to the next logical number, which is 2, then the next logical letter, which is B, then the next logical number is 3, then the next logical letter is C, and so on and so forth. Here you copy a cube, and we're pretty strict with how the lines connect. Here you draw a clock, put all the numbers, and put the time 10 past 11. This one can be tricky because you really have to understand visuospatial cognition and remember that the numbers represent minutes and hours, and it uses a lot of different cognitive domains. Naming is really important, and it tests your language. A lot of patients with early dementia make mistakes and call this animal a hippo, but it's actually a rhino if you notice its horn here. We test memory by giving patients 5 words, and then at the end of the test, we ask them to repeat these 5 words to us. This is often the most hardest part of the test because it requires a lot of attention, and we kind of distract you in the middle with all sorts of other tasks. So this one is tricky. We test attention by asking you to repeat digits and hit the table when you hear a certain letter. We do mathematics by asking you to subtract. We ask you to read, and then we ask you to name different things. So, to remember, dementia is really a spectrum disorder. In most people, you're never going to have perfect cognition because as you age, there is a slow, steady decline, and you're going to find that your thinking gets a little slower, things don't come as easily to you, and that is very normal. The problem is, and the challenge I think as a doctor, is to figure out who is just on this normal aging pattern and who is in a preclinical or silent phase that's going to eventually turn into dementia. It's pretty tricky, and it involves doing MoCAs, looking at brain scans, understanding family history and their overall health, and following them up really regularly because some patients may seem like they're going to get dementia, but then they just kind of stable out. Other people don't seem like they're going to have dementia, but then they sharply decline. And so there's no way that you could have a crystal ball and figure out who's going to get dementia, but you can watch them closely and try and identify them early. In general, if you are going to develop dementia, you go through 2 other stages. The first is called a preclinical stage, where it's basically silent. Your brain is undergoing the changes that, we'll talk about later that causes dementia, like you're accumulating these toxic proteins, but you're not really exhibiting any symptoms yet because it's really silent, and it happens years before you're going to get dementia. You may notice some really, really subtle things, but it's really not even detectable on tests. You may notice stuff, but your friends, your family, the doctor, we have no idea, and it's really hard to diagnose. After that, though, you can move into mild cognitive impairment, which is about a 22 out of 26 on that MoCA test. Here, you do have cognitive changes that are of concern to you and or family and friends, and 1 or more of your cognitive domains are impaired. However, you're able to do your activities of daily living. What are activities of daily living? Well, they're basically all the tasks that allow you to remain independent. So that includes shaving, grooming, dressing yourself, bathing, preparing a meal, being able to drive, balance your checkbook, things that, require independence. Once you move into dementia, you have cognitive impairment in multiple cognitive domains, just like MCI, but it's a little worse. And it's so much worse that now it really interferes with your everyday abilities and your activities of daily living. So you're now no longer really independent. So that's really what differentiates MCI, or mild cognitive impairment, from dementia, because your activities of daily living are preserved in MCI and you're able to still remain independent even though you're having troubles. And in dementia, you really can't. Now, within dementia, there's mild, moderate, moderately severe, and severe. All you need to know is that severe is where, patients are bedbound, they're not talking, they're totally just kind of like a comatose type of person. Mild is that they're pretty confused, they really can't take care of themselves anymore, but they're not, lying in bed paralyzed. So it's a whole spectrum within dementia. So let's talk about mild cognitive impairment again. It's a clinical diagnosis, so we make it based on a MoCA and, physical exam findings. It affects about 15% of the population, which is pretty high in more than 70 years of age. But in 5 years, though that 15%, some will improve, especially if their mild cognitive impairment is due to strokes and other things. If they clean up their diet and exercise, 1/3 can improve. 1/3 will just stay stuck at MCI, and 1/3 will progress to dementia, which can be, devastating. So now we're going to talk about the most common form of Alzheimer's. Alzheimer's disease is a neurodegenerative disease, which means that the brain and its structures start to degenerate. It's diagnosed clinically. There's no blood test or quick imaging or any one test that can tell me that you have Alzheimer's. It's really a nuanced, kind of beautiful pattern where you have to figure out, based on their MoCA, how they appear on physical exam, and what parts of their cognitive domains are affected rather than others. And that's how you can kind of deduce that someone has Alzheimer's. The only way to really definitively say someone has Alzheimer's is after they pass, and if you're allowed to do a brain biopsy because the family or the patient wants an autopsy for science, and then you take a piece of the brain and look at it, and you look for 2 specific proteins which are pathognomonic for Alzheimer's disease. There's 2 proteins involved in Alzheimer's that you look at to diagnose Alzheimer's, and that is a beta amyloid protein and a tau protein. When these proteins build up in the brain and become insoluble, they cause Alzheimer's disease because it's toxic to the neurons. I want you to remember 2 buzzwords, plaques and tangles. All I want you to know is that beta amyloid, when it gets irregular and builds up, it forms these insoluble structures called plaques. And when tau builds up, it forms tangles. A way to remember this is that tau starts with T and it forms tangles, which starts with T. So tau and tangles, and beta amyloid and plaques. The symptoms usually begin after age 65. There is a very early onset Alzheimer's, which is a very rare form of Alzheimer's, and it's not the most typical one. So when you see patients and you hear about Alzheimer's, most likely it's the sporadic form, which happens after age 65. Less than 1% have the early onset Alzheimer's before age 65, and it's usually a very clear family history, and we know about it because everyone in the family basically has it. So now let's talk about the beta amyloid that forms plaques, the 2 buzzwords I want you to know. So basically we have this protein in the brain, and it's normal. It has enzymes that cut it in different spots that allows the protein to work and then get chewed up by different enzymes when it's no longer needed so that it doesn't build up in the brain. However, there's different mutations where basically the enzymes cut them in the wrong places, and for some reason they get out of the cell and form these aggregates called plaques in the extracellular space. And this excess amyloid is what causes a lot of problems that leads to Alzheimer's. The second buzzwords I want you to know about are tau protein and tangles. So the tau protein is also a normal protein found in the central nervous system, and it stabilizes microtubules of axons of neurons. When tau for some reason gets hyperphosphorylated, and we don't really know the reasons at this time, they form these insoluble tangles in the inside of neurons, and this accumulates and leads to Alzheimer's. This is a picture of a brain biopsy, which means that a piece was shaved off and looked at under a microscope, and 2 different proteins were stained for. The beta amyloid, which forms plaques, and the tau